Sexually transmitted diseases, STDs, also known as sexually transmitted infections, STIs, are infections primarily spread through sexual contact. STDs are caused by various pathogens, including bacteria, viruses, and parasites, and can affect anyone who is sexually active. The spread of these infections can occur through vaginal, anal, or oral sex, as well as through skin-to-skin contact, sharing needles, or during childbirth from mother to child. While some STDs can be easily treated, others can have long-term health implications if left untreated. Early detection and treatment are crucial in preventing complications, which can include infertility, chronic pain, and increased risk of contracting other infections such as HIV. Common types of STDs: bacterial infections. 1. These are caused by bacteria and can generally be treated and cured with antibiotics. 2. Cus. Chlamydia trachomatis bacteria. 3. Symptoms. Many people may not exhibit symptoms. 3. However, symptoms can include abnormal genital discharge, pain during urination, and pelvic pain. 4. Complications. If untreated, chlamydia can lead to pelvic inflammatory disease, PID, in women, which may result in infertility. 5. Treatment. Antibiotics, usually azithromycin or doxycycline. 6. Cus. Neisseria gonorrhoeae bacteria. 7. Symptoms. Like chlamydia, gonorrhea may not always present symptoms. 7. If symptoms occur, they often include burning during urination, green or yellow discharge, and pelvic pain. 8. Complications. Untreated gonorrhea can also cause PID in women and infertility in both men and women. 8. It can also lead to infections in the eyes, throat, and joints. 9. Treatment. Antibiotics, though there are increasing concerns about antibiotic-resistant strains of gonorrhea. 10. Cus. Treponema pallidum bacteria. 11. Stages. Primary stage. Painless sores, chancres, appear at the site of infection, usually the genital area, rectum, or mouth. Secondary stage. Skin rashes, mucous membrane lesions, and flu-like symptoms may develop. Latent and tertiary stage. If left untreated, syphilis can enter a latent phase, eventually leading to severe damage to the heart, brain, and nerves. 12. Treatment. Penicillin injections are the primary treatment for syphilis. Viral infections. 1. Viruses that cause STDs cannot be cured but can be managed with antiviral medications. 2. Cus. The HIV virus attacks the immune system, specifically CD4 cells, T cells. 3. Symptoms. Early symptoms resemble flu-like illness, fever, chills, rash. 3. Without treatment, HIV progresses to AIDS, where the immune system is severely compromised. 4. Transmission. Through sexual contact, blood, and from mother to child during childbirth or breastfeeding. 5. Treatment. Antiretroviral therapy, ART, helps manage HIV, allowing individuals to live longer, healthier lives, but there is no cure. 6. Types. HSV-1 primarily causes oral herpes, cold sores. HSV-2 causes genital herpes. 7. Symptoms. Painful blisters or sores on the genitals, anus, or mouth. 8. Complications. Recurrent outbreaks are common, though they tend to become less severe over time. 8. HSV can be spread even when sores are not present. 9. Treatment. Antiviral medications like acyclovir or valacyclovir reduce symptoms and decrease the frequency of outbreaks but do not cure the virus. 10. Cus. HPV is a group of more than 100 related viruses. 10. Some types cause genital warts, while others can lead to cancers, such as cervical cancer. 11. Symptoms. Many people with HPV do not show symptoms. 11. Some may develop genital warts, and certain high-risk strains can lead to changes in cervical cells. 12. Complications. Persistent infection with high-risk HPV strains can lead to cervical, anal, or throat cancers. 13. Prevention. HPV vaccines, such as Gardasil, protect against the most dangerous strains of the virus. 14. Treatment. There is no cure for HPV itself, but warts can be treated, and regular screenings, Pap smears, can detect precancerous changes in cervical cells. Parasitic infections. 1. Parasitic STDs are caused by parasites and can be treated with specific medications. 2. Cause. Trichomoniasis vaginalis parasite. 3. Symptoms. Many people are asymptomatic, but some may experience itching, burning, redness, or unusual discharge. 4. Complications. If left untreated, it increases the risk of contracting other STDs and can cause pregnancy complications. 5. Treatment. Oral antibiotics, typically metronidazole or tinidazole. 6. Cause. Infestation by parasitic lice that live in coarse body hair, primarily in the genital area. 7. Symptoms. Intense itching, visible lice or eggs in body hair. 8. Treatment. Over-the-counter or prescription topical treatments to kill the lice. Transmission and risk factors. STDs can spread through several modes of transmission. 1. Sexual contact. Vaginal, anal, and oral sex are common ways STDs are transmitted. 2. Skin-to-skin contact. Certain STDs, like HPV and herpes, can spread through direct skin contact, even without penetration. 3. Blood transmission. Sharing needles or exposure to infected blood can transmit HIV and hepatitis B. 4. Mother to child. Some STDs, such as HIV, syphilis, and herpes, can be passed from a mother to her baby during pregnancy, childbirth, or breastfeeding. Certain factors increase the risk of contracting STDs. 1. Multiple sexual partners. Engaging with multiple partners increases the risk of exposure to infections. 2. Unprotected sex. Not using condoms or dental dams increases the chance of transmitting or contracting infections. 3. Substance use. Drugs or alcohol may impair judgment, leading to unsafe sexual practices. 4. Previous STDs. Having a history of STDs can increase susceptibility to future infections. 5. Co-infection. People with one STD may be at higher risk of contracting another, such as HIV. Prevention and safe practices. 1. Condom use. Consistent and correct use of condoms reduces the risk of contracting most STDs, though it may not prevent those spread by skin-to-skin contact, e.g., HPV, herpes. 2. Regular testing. Regular STD screenings, especially for sexually active individuals, can help in early detection and treatment. 3. Vaccination. Vaccines, such as those for HPV and hepatitis B, offer protection against certain infections. 4. Mutual monogamy. Engaging in a mutually monogamous relationship with an uninfected partner reduces the risk of STDs. 5. Communication. Open conversations with partners about sexual history, STDs, and safe sex practices are essential for prevention. Conclusion: STDs are a significant global health concern, affecting millions of people each year. While some are easily treatable, others require lifelong management. Preventative measures, early diagnosis, and prompt treatment are crucial in controlling the spread and impact of these infections. Education, awareness, and safe sexual practices can help reduce the incidence of STDs and protect individual and public health.